Hey everybody, hope everybody is doing well and staying safe out there. Thanks as always for being on our monthly webinar. Our last chat was over a month ago now. It was on December 16th, and to say that a lot has happened in that time is an understatement. I mean, I guess that said, you'd be hard pressed to find any month over the last year that wasn't completely overwhelming. But we now officially have a new president and a new Democratic-controlled Congress, though in the Senate that majority won't mean as much, as we will discuss on this webinar. But a lot of the same old problems still exist, different priorities, partisan gridlock. All of those things are still there, and we will talk about all of this as we go forth today. But as always, thank you for being on. We'll start with another update on the rollout of the COVID vaccine. This will seem familiar to you if you were on the last webinar in December. We continue to get calls. I continue to get calls looking for guidance on where orthotists and prosthetists fit into the rollout. You'll recall that AOPA reached out to HHS and the CDC to ensure that our members could be among the first to receive the vaccine. And while we never received an official response, it does seem like our suggestions were heard. Which is great. In most cases, you are viewed as frontline workers, certainly by the HHS and the CDC, but that it comes down to states, as I'll discuss in a minute. The CDC issued guidance last month that notes, as you would expect, that healthcare workers should be the first in line to get the vaccine. But and this is where it gets tricky, that doesn't necessarily mean you'll be the first in line in your state. Individual states, and in some cases, individual counties, write their own protocols and are doing their own coordination of the rollout, some with more success than others. And having dug deep into these as we get calls and hear more information, I can tell you that there are significant differences in just about every state's rollout plan. Some spell out O&P specifically. Again, this is not news to you if you were on last month's webinar, but New Hampshire, as well as a few other states, specifically name O&P as high-risk healthcare workers and therefore have early access to the vaccine. They're in what a lot of states are calling 1A. If not 1A, then certainly 1B. In addition to, to differing priorities, many states, as you know, are also hampered by a lack of having actual vaccines on hand. There simply just aren't enough of them to go around at this point. If you have questions about your state, by all means, reach out to me, reach out to your state's Department of Health. I have heard from numerous AOPA members that their state Department of Health was able to tell them exactly where they fit in the hierarchy and help them get vaccinated. So reach out to me, reach out to your Department of Health, and we will help in any way we can. And on that note, real quickly before I pause for questions, I haven't plugged our legislative and regulatory page on the, well, actually I haven't plugged any page on the AOPA connection and the My O&P community. This is, hopefully you've all seen this, but it's a relatively new feature on our page in which you can connect with other folks in the O&P community, share information. We have a page set up specifically to share information and intel on vaccine rollouts. And I hope that you will post what's going on in your county and your state. It's been very helpful to see, as I said, how varied this rollout has been. And I would also like to hope the legislative and regulatory page on AOPA Connection. Again, relatively new, but I will be posting the latest information as we get this on this page. I'm happy to answer any questions you have, any discussions you would like to start in on there. I think it's going to be a great tool to talk with all of you and get these dialogues going. I would ask, of course, that we make sure the conversations pertain to O&P. I know it is a legislative and regulatory page, and legislative and regulatory discourse these days veers off into some interesting directions. But of course, this is not the place to get into partisan conversations trying to promote specific political ideas or agendas. Let's keep that civil, but by all means, let's have a conversation. And please do post on there any questions that you may have about what's going on in Congress or anything we're working on at AOPA. There's always more that we're doing than I can list on these webinars, so happy to talk more about that. But let me pause very briefly there to see if anybody has any specific questions about vaccine rollouts or anything else that I might have mentioned so far.
Not seeing any questions yet.
Yep, and obviously as this goes on, if any questions come to mind about vaccine rollout, anything else, please do weigh in. Happy to answer all of those as we go on. So when we last met, Congress was on the cusp of passing a COVID relief package, which was tied to an appropriations omnibus bill to fund the government through September of this year. As you've hopefully seen in our emails, that bill was passed. It passed 359 to 53 vote in the House. and it was 92-6 in the Senate, and that was signed by the president back on December 27th. This again was actually two entirely different bills rolled into one. It was a COVID package and a bill to fund literally every government program in existence. It was an omnibus appropriations bill, which funds every single government program. Thus, it ended up being more than 5,500 pages long. You probably heard a few politicians who definitely know better talking about, well, there's all these extraneous things in the bill that have nothing to do with COVID, and questioning why they were in there. Why is there funding for museums? Why is there funding for national parks? Any politician who asked that knew the answer. Again, this was two bills. It was a COVID package, of course, but it was also a full omnibus spending bill. So the majority of it was, in fact, not COVID related. It was the funding portion of the bill. I mean, obviously, every government program had to be funded, so they're all spelled out in there. And they're all certainly not related to COVID. So that was specious by a number of politicians. We didn't get everything we wanted in this bill, to be sure, but there were some wins for us that we were fighting for. The biggest of which is that businesses that received PPP loans are able to take tax deductions for the expenses covered by those forgiven loans. You might recall that last year, I mentioned on a couple of different webinars, IRS had released guidance. They did this not once, but twice, saying that PPP loans and provider relief funds were taxable. It obviously seemed unreasonable to us that if you're trying to reduce the burden of the pandemic on small businesses, that you would make these funds taxable. You're not only taking money out of the pockets of these businesses, but you're imposing a ton of extra work for their accountants and making the actual rules around this fairly difficult to understand. So luckily that burden has been eliminated, which should help as you move into tax season. Another big win for us was the 3-month delay on Medicare sequestration and payment reductions. We are working on a further delay on that. I can't promise, but I think you'll see an even longer delay of sequestration as part of the next COVID package. And we'll talk more about that COVID package in a second. But a little bit more on the tax implications of the bill that passed. Your accountants will almost certainly be up on this ruling. The IRS has already issued more specifics around this, more guidance on this. And since we're in tax season, you know, I'm sure your accountants are getting up to speed. But I'd also note that if you do seek another draw on the PPP program, maybe you haven't done that yet, or maybe you've only taken one draw on the PPP, that funding won't be taxable either. Essentially, as long as this program exists, no money that comes through it will be taxable. That said, this will almost certainly be the one that just passed at the end of last year will almost certainly be the last replenishment of that program, of the PPP. So if you haven't gotten one yet and think that you need one, or you know, think that would help to keep you going for the duration of this pandemic, and of course, you know, we're still not quite sure when this is all going to come to an end given the slow vaccine rollout. This would be the time to go after those PPP funds, simply because there may not be another shot at it in the next COVID package. Let's talk about what's going to be going on in Congress for the next couple of months. And it really only revolves around two things. It revolves around impeachment and COVID. There will be a flurry of other activities, to be sure, such as President Biden's cabinet nominations and other things getting done, but these are the things you are going to hear about the most by far. And both of them are going to be, as a lot of things are in DC these days, bizarrely complicated. It's great news for policy wonks like me, and well, policy dorks, let's face it, like me, but not the best news for most people. So if you'll indulge me, I will talk you through how this is going to go, and I will at least attempt to keep it interesting. So bear with me if it is not that way. First off, this is everything President Biden wants in his next COVID package. To say this is a heavy lift is an understatement. It's a $1.9 trillion proposal, trillion with a T. Some of it is pretty easy, such as expanded payments to taxpayers. You heard last year even some Republicans favored a $2,000 check to most taxpayers as opposed to just the $600 check that passed. So that's got some traction. But other facets of this, like a federally mandated $15 minimum wage, are going to run into some strong opposition, and indeed already have. But the Biden team's game plan here is the same as Nancy Pelosi's when the House passed an enormous relief bill last year. Remember, the House passed that, I want to say it was a $1.6 trillion bill, somewhere thereabouts, that had everything but the kitchen sink in it. So the goal is you put everything in this one bill, and then when it comes time to negotiate, you only push for those things that you really want. So that will be the plan. It seems like, well, 1.9 trillion, I mean, obviously 1.9 trillion is a lot, but I don't think that Biden or congressional Democrats have any intention of actually getting a $1.9 trillion bill. It's let's throw everything at the wall and see what sticks. And I already mentioned that what's not likely to be in there is additional money, certainly not for the PPP, and almost definitely not for the Provider Relief Fund. You recall the difference is the PPP is the one you had to apply for through the Small Business Association. The Provider Relief Funds were the ones that might have randomly just showed up in your checking account for your business, provided by the Department of Health and Human Services. Some folks got 2 rounds of that, some folks got 1. There will be no more of that funding in the next COVID bill. I was on a Zoom with Congresswoman Robin Kelly of Illinois last night. She's the new vice chair of the Energy and Commerce Committee, the full Energy and Commerce Committee. And she says there is no talk of revving up or re-revving up, I guess, as it were, the Provider Relief Fund. So that will not be in that bill. There is no more money coming from that program either. But keep in mind, we're a long way from actually writing this bill. And despite it not being written, it is still facing some serious pushback from both sides of the aisle. Congress is also very much up against the clock on this. Joe Biden has said he wants this passed as soon as possible, but there is simply no realistic chance of getting this done before mid-March, really at the earliest. And that date is key because the $300 weekly federal unemployment payments run out on March 14th. So the actual goal to get this done is March 14th or around mid-March, but even that's next to impossible because of the huge amount of hurdles we will have to get through to even get this bill for a vote. And I am, as I mentioned, about to break out a whole bunch of obscure congressional process minutia, so bear with me. I'll try to keep it interesting. The first step in any of this is the House and Senate budget committees need to pass a budget agreement that sets the parameters for the bill. This is standard operation. It's not just because of this bill, but it's a little different because of, you want a $1.9 trillion bill, you have to put a budget together that allows for that. The House Budget Committee will begin work next week on a budget resolution. So they say that would include reconciliation instructions. I'll talk more about reconciliation in a minute, but essentially that's the beginning of a process that allows for a 51 vote threshold in the Senate rather than the standard 2/3 majority. As you all know, you can filibuster a bill and you can have legislation that needs to pass with a 2/3 majority in the Senate. Something being done under budget reconciliation only needs 51 votes. We'll come back to that. Remember that. Now, it'll be easier to pass the budget resolution with reconciliation out of the House, even though it might take a little longer, where Democrats have a bigger majority. In the Senate, the Budget Committee will likely, they haven't officially created the Budget Committee yet, but it will likely be split evenly just as the full Senate is. Of course, the Senate is now 50-50 after 2 Democrat wins in Georgia, and the committees will reflect that. So it's a little tougher to get that done in the Senate, even though Schumer has said he wants this done in the Senate. He wants it to be done next week. So it can come to the floor for a vote. I would expect that the House will probably be working just as quickly as the Senate will. But Schumer says he wants it out of the Senate. The House says they want it out of the House. But efforts are already ongoing in both. Leading the effort in the Senate will be the brand new chairman of the Senate Budget Committee, someone who you might have seen a time or two on social media this past week, Senator Bernie Sanders. He is anxious to get to work on this bill. No one has been pushing more for COVID relief over the past year than the man in the mittens. But again, his committees or likely will be evenly split. So getting all this done and ready to go to the floor next week will be tough, very tough to say the least. But no matter when it comes to the floor, that budget agreement, no matter how long it takes him and no matter what it looks like, that budget agreement will almost certainly contain a procedural apparatus that I've already mentioned called budget reconciliation. A budget reconciliation bill can be passed with a simple majority, allowing the Senate to avoid filibusters and to ensure that the bill will eventually come to a vote. The budget cannot be stalled because of a filibuster. It does not need to be signed by the president. If the budget bill calls for reconciliation, it tells certain committees, most committees really, to change spending, revenues, or deficits by specific amounts. It spells out those things. The idea being that such things require quick, decisive action, and they shouldn't require a 2/3 majority. They should be easier to pass. To answer a question you didn't ask, if reconciliation only requires 51 votes, why would the majority party not use it for every single bill that comes to the floor in the Senate? And there are 2 reasons. One is there are special rules which are designed to protect the rights of the minority party in the reconciliation process. Only policies that change spending or revenue can be included in anything reconciliation related. So you do, as the minority party, get to have certain things to your advantage. And it's even more things now since there technically isn't a minority party. Kamala Harris obviously is the tie-breaking vote should it come to that. But as you probably saw in the news, Chuck Schumer and Mitch McConnell have come to a power sharing agreement, which allows both sides leeway based on their party. The other reason you don't want to use reconciliation on every bill is because you can't really stop anyone from bringing up amendments at all. And it creates what for us here in DC is a lot of fun, but for the purposes of good legislating is not so much fun. It's called a Votearama. A Votearama is not a technical term. It's just something that sounds a hell of a lot more fun than it is, like a lot of things we come up with here in DC, I suppose. But it means that any senator can offer an amendment to the budget. In 2017, during the budget resolution, there were more than 700 amendments brought up. I have already been told by a friend on the budget committee to expect about 1,000 amendments as they go into this budget reconciliation language. These amendments are mainly for messaging purposes, and only a small and a very small fraction of them will get an actual vote. But they do slow down the process big time. The upside of that, in as much as there is one, is it gives us an opportunity to get some of the OMP Patient-Centered Care Act offered as an amendment. It's highly unlikely it would get a vote, probably wouldn't even come up for a vote, much less pass. But any chance to get our language in front of senators to try to push it is a good thing. So we will be recommending to our champions, and we'll talk more about that later, that this comes up should we get into a Votearama, and we almost certainly will, that our OMP Patient-Centered Care Act comes up as an amendment. So to catch us up, you've got a contentious process writing a budget resolution that would create the framework for a $1.9 trillion coronavirus bill. Then you've got to pass the budget resolution, knowing that there will be a massive, probably days-long Votearama. And then after all that, assuming you pass the budget framework, you still have to actually write the COVID bill. Remember, Biden's plan is just that. It's a plan. There's no legislative language attached to it yet. So each committee has to go in and write legislation to do what Biden wants to do. The Ways and Means Committee on the House side has a big chunk of the work to do on the House side. Same with the Senate Finance Committee on the other side. But Biden's proposal is so broad that several other committees will get pulled into this too. When you're talking about vaccination and testing programs, you're talking about food stamps, school aid, raising the minimum wage. It is a hugely ambitious plan that will touch just about every congressional committee, all of whom have to write their own individual parts for that bill. And again, it's interesting that the House may revert to some language that they had in the HEROES Act, which I mentioned earlier, but you have to pass the whole thing again. Just because they passed this big bill last Congress, it does not carry over. No legislation carries over. So they're going to have to pass it all, write it all, and pass it all again. And as if that wasn't enough, all those barriers, you also, on the Senate side, have to withstand challenges to what's called the Byrd Rule. This is one more piece of procedural jargon. The Byrd Rule limits what kind of policies can be included as part of a budget reconciliation. So Democrats could see some critical elements of their bill, like the minimum wage, knocked out because they're not germane to the framework passed by the Budget Committee. And there will be a lot of people, a lot of senators on both sides claiming that things don't apply to the Byrd Rule, or the Byrd Rule prevents them from being brought up. So that's everything they're up against from a procedural perspective. If you wonder why it takes so long to pass legislation, some legislation here in DC, that's why, because of all these blocks in the road, all of which are intended to make sure that legislation that is passed is good and necessary, but it obviously takes a lot of time. So those are the procedural roadblocks, but lest we forget, there is another roadblock. For the first time in history, a former president is facing an impeachment trial. These are the House impeachment leaders walking the articles of impeachment over to the Senate at about 7 o'clock last night or the night before. I honestly don't remember. Time has lost all meaning. The Senate is still working through how this trial will work. And you've been hearing ad nauseum about how we're completely in completely uncharted waters as far as the impeachment trial of a former president. At the end of the day, it is highly unlikely to see Trump convicted of anything, but it will take up time and energy and slow up not only the COVID bill, but Biden's cabinet nominations. The Senate has been working extremely hard to get as many of those on in the early going as they can. But once this trial gets heated up on February 8th, that's going to take a lot of floor time and a lot of time away from the Senate and the senators. And it's also going to require a heck of a lot of congressional procedure. So that's what they're up against in terms of this COVID package. As I mentioned, there will be other actions going on tangentially. It won't be all COVID all the time. Obviously, other bills get introduced. Committee work will see other bills get passed out of committee. It's not the sole focus of it, but between the COVID package and the impeachment hearing, this is what you're looking at for at least the next couple of months in Congress, taking up most of the time. So let me pause there. I know I just threw a heck of a lot of congressional jargon at you, but let me pause there, see if anybody has any questions about, well, anything that I've talked about so far. Clear as mud, as they say, I'm sure. So you've heard about our, Congress's priorities, the COVID package and getting that trial done. Let's talk about our priorities, which, again, if you were on the webinar last month, you saw these, but we are most concerned, of course, with getting the Medicare, at the moment, getting the Medicare O&P Patient-Centered Care Act reintroduced. All of our champions for that bill are back. They all won re-election. We'll talk about some logistical things that we're working on in a second. But I also want to remind you of our other efforts, including legislation and regulation that would boost minority representation in our industry. I also chatted last night with Congresswoman Kelly about that. She is the chair of the Congressional Black Caucus Health Brain Trust. She has worked on disparity issues in healthcare her entire career and is very enthusiastic about helping us work on legislation and regulation to help steer minorities into our industry and become O&P professionals. And the CBC, as I think I mentioned in the last webinar, the CBC, the Congressional Black Caucus, has shared our recommendations with the Biden administration. So our next step there is to continue our dialogue with the Biden administration, who have been very, very open to working with our industry and hearing from our industry about things that we want to focus on. So these are all still in the early stages. You'll be hearing about these next month in next month's webinar for sure. But to come back to the O&P Patient-Centered Care Act for just a minute, I said that all of our champions were back. In the Senate, it was Mark Warner and Steve Daines. Mark Warner, the Democrats, Steve Daines, the Republicans, were the lead. In the House, it's Mike Thompson from California and G.T. Thompson of Pennsylvania. We're in an interesting congressional place right now in terms of who certain members of Congress want to work with and who they don't. G.T. Thompson, who you see in the upper left corner there, is one of the 147 Republicans who voted to essentially voted against certifying the election results. They are facing some not just backlash from the American public. They're facing backlash from within Congress from other members trying to strip them of committee leadership, saying that they won't work with them on legislation. And the ones I listed up here are not by accident. G.T. Thompson was the lead on our bill. Mike Kelly and Jeff Van Drew were both co-sponsors of the bill. They signed on after that came out. Brian Mast, I'm sure you all know, is the only double amputee in Congress. We work with him on a few different things. Michael Burgess is chair or is a ranking member of the Energy and Commerce Health Committee. Was, I should say, he's out of that now, but he was at the time. So he's someone who's very entrenched in the kind of issues that we work on. And of course, Kevin McCarthy is the minority leader. So all of these folks voted against certifying those election results, and it's really, to be honest, a kind of gray area right now. I anticipate there will come a time where the dust sort of settles on this outrage in terms of these guys. You can't keep them out of the congressional process forever. They're elected officials. But it does put us in a weird position early on in terms of having G.T. Thompson as the main Republican sponsor of our bill. The other person who is a Republican lead on that bill is Congressman Brett Guthrie from Kentucky, who was very on board with co-sponsoring again. But now I mentioned Mike Burgess was a former ranking member on the Energy and Commerce Health Subcommittee. That is now Brett Guthrie. So very, very good that we've got someone who is such a champion of our issues now as the ranking member of that committee. And of course, Anna Eshoo is the chair of that committee, and she's a great supporter of ours as well. In fact, I'm on a Zoom with her later today. So that's great news, but it also puts Congressman Guthrie in a bit of an odd position in that many times leaders of committees, whether they be chairs or ranking members, whether they be chairs of full committee or subcommittee, don't necessarily want to be the lead on legislation that is referred immediately to their own committee. It's kind of seen as self-serving. So, you know, I mentioned Anna Ashley was a big supporter of our bill. She's not a co-sponsor of it because she has jurisdiction over it. She can't sign on to a bill that's referred to her own committee. It does happen. I don't want to say it doesn't happen, but it doesn't happen terribly often. So we're working with Brett Guthrie's office to see if he'll be the lead, despite the fact that he is now the ranking member on that committee. Quite frankly, it would be better to have Guthrie as the lead, simply because it's better to have someone on committee as the lead. G.T. Thompson, as a greatest supporter of our issues as he has been, is not on any committees of jurisdiction. He's not on Ways and Means, and he's not on Energy and Commerce. So having Guthrie is better, period, all around. But there is a question of whether or not he will be willing to do it, simply because he is taking over as ranking member. That said, even if he doesn't do it, it obviously gives us a great venue to get a hearing, to get a markup on this bill, now that someone who's such a champion is overseeing the committee, helping to oversee the committee. Real quick before I stop altogether for questions, I did want to talk a little bit about the virtual policy forum and ask you all to save these dates. I know that you're having a bit of a heart attack right now going, why is the policy forum 6 days over 2 weeks? I want to impress right off the bat, you will not need to be there from 9 to 5 all 6 of these days. That is not the way we're doing it. So don't feel like you need to be blocking 6 days off your calendar. That's the number one takeaway from this slide. The way we're going to do it is simply because we are virtual. We don't want to be tethered to one day. I think that, you know, as organizations in DC have worked on feeling out how we do these things in a virtual environment, we all came to the conclusion, you know, that way we had to do it in real life, when everybody came to DC and you had 1 day of education and training, and then you went up to the Hill the next day. There's no reason we have to do that in a virtual environment. We don't have to limit everything to 1 day. So having said that, April 20th will be that kind of, you know, 2-3 hours in the morning of education and, you know, going over our issues with a fine-tooth comb. We'll have a couple of guest speakers. I hope to have at least one member of Congress join us at that April 20th session, which will be in the morning. And then for the rest of April 20th, the 21st, and the 22nd, we will make your appointments for you to meet with your senators. Again, you know, this isn't going to be a 9 to 5 thing. It'll probably be 15 minutes out of one or both of those days to get you set up with a time for your senators. But we did want to leave all 3 days open, just so there's more wiggle room, both for you and both for members of Congress, to be able to have that time to meet with us. There's no reason to condense this into 1 day. It also allows us to carry our message that much further, instead of just saying, oh, it's advocacy day for AOPA, it's advocacy weeks, it's advocacy month. Like, we can make a bigger presentation out of this. So 20th, 21st, and 22nd for the Senate appointments. Then the next week, and these are Tuesday, Wednesday, Thursday, by the way, the 20, 21, and 22, 27, 28, and 29. On the next week, the 27th, 28th, and 29th, again, on the 27th, we'll have a much more condensed education session just to go over our issues again, talk about some of the things we'll be talking about that week, talk about some of the best practices we'll have gleaned from the week before. Obviously, having those Senate visits the week before will provide some good trial and error for what we're trying to do. And then we have our House appointments that week. Again, you don't need to block off all 3 days. Just you'll have one meeting with your representative, and that will be the time that you'll take out of those 3 days. Unlike in the Senate, where we're going to make the appointments for you, we are asking all of our attendees to make their own appointments on the House side. We will help coordinate those so that, you know, if we've got more than one person coming from your congressional district, we can connect you to make sure that we're all on the same page. We can give you the name of the staffer that you need to reach out to, phone number, email address, all of that. But we're asking you to make those appointments yourself to start that dialogue with your congressional offices. You know, if you're going to be advocates, if you're going to help us out with our advocacy initiatives, getting to know your congressional office, the members, your member of Congress and their staff, is a huge step. So we will help you as much as we are able, but we are asking folks to make those appointments on their own. Again, we'll coordinate so we don't have 7 people from the same district having 7 different appointments. And frankly, given the numbers, the great numbers we had last year for our policy forum, we had over 300 people register. Making those appointments of ourselves would be a logistical impossibility. So we appreciate folks helping us out in that regard. With that, just a reminder that our next webinar will be February 17th, and I will stop there and see if anybody has any questions on anything that we've discussed. I know that was a lot of information for just a half hour, but happy to hear anything that's on anybody's mind.
Not seeing any questions at the moment, Justin.
Okay, if anybody has any questions at all, by all means, there's my email address, email, call. I'm always happy to chat with folks about any of this. And I look forward to sharing more information with you about the policy forum, which you'll hear a lot more about over the next month as we open up registration. And I look forward to seeing you all on our next webinar on February 17th. Thanks, everybody.